Hi, everyone. Natasha Trenev, and it's my pleasure to really have two phenomenal guests today. Our topic is really of interest to everyone because all of us have been affected by it, and we call it the Neuro-Gut Nexus, unraveling the mysteries of ADHD, autism, and anxiety. And we have would I call you Dr. Anthony Silver?
Anthony Silver's fine.
Anthony's fine, and Vincenzo Fata, who run the Gray Matters Clinic. And we've worked with Vincenzo closely in our holistic approach to dealing with autism, attention deficit, and anxiety. And I'm sure anxiety also deals with some depression. So we're trying to figure out how to best approach helping people who come to the clinic with this problem from both the gut and the brain perspective. So Anthony, I'll let you go first. Please give us some background and your clinic status and how you're serving your community so that they can know the services available to them.
Sure. So I'm the founder and director of Gray Matters. We founded the company about 18 years ago. It's really based on incorporating modern neuroscience, functional brain imaging, into the way people of all ages are diagnosed with mental health issues, with the idea that the way people are diagnosed is very subjective, and it's really out of touch with the way modern science has progressed. So we can now measure, record, really quantify brain activity in a way we never could before, which makes a lot of the diagnoses that we're used to pretty obsolete, overgeneral, and now we can really dig in and see how the brain is actually working and design protocols and treatments that resolve underlying issue rather than kind of shooting from the hip like you see in modern psychiatry. So we're really there to help people apply modern neuroscience and make a real difference based on what is available now.
Great. So we've worked with Vincenzo, who runs one of the clinics, and he successfully used our protocol, our precision probiotic protocol. We have two brands. One is Natren for the professional, and the other one is Natren, who sponsors this. So Vincenzo, would you like to share? And then I'll go into a brief overall explanation how the brain-gut nexus really works.
Yes, ma'am. So I've been a school-based psychologist for the last 15 years in the state of New York, and then a licensed mental health counselor in private practice. And over the course of the last several years, I had been finding that in my private practice, I had been getting away from dealing directly with patients, students, children with regards to therapy, and I was doing a lot more parent advocacy because of a lot of miscommunications happening in schools and with doctors' offices with regards to over-medication of children. And I had found Anthony, and we'd spoke a bit, and I expressed interest in neurofeedback therapy as an alternative. And I know we hate the word alternative medicine, but as an alternative to medicating our students, medicating our children overly. And I had found Natasha with regards to the probiotic, and I like to take a very integrative, holistic approach to treating patients. And I've been fortunate enough to train under Anthony and take on the role as clinical director of the Greenwich office of Gray Matters this past year. And we've been having really great success in symptom alleviation in the patients we've been serving. So I'm really pleased to kind of integrate these two worlds and bring everybody to a more holistic, more healthy state.
Yeah, great. Thank you. So I want to give everyone a little overview of why the brain and the gut are so connected. So I have some stats that are rather staggering. The right microbiome needs to be implanted in the child right after birth. Unfortunately, the one bacteria called Bifidobacteria infantis has disappeared in North America, where less than 7% of women who delivered children vaginally are able to get this bacteria transferred to the child and maintained by breastfeeding. So we have a crisis in this bacteria not being present, because it's the only bacteria that actually interacts with the newly formed immune system to develop tolerance, so that the immune system doesn't overreact when there's nourishment going across the intestinal wall, and when there is a problem, to communicate with the immune cells on the intestinal wall of the developing child that there's something at hand here that needs to be handled. And I think right there is the beginning of the problem of this process, where we have now 1 in 36 children, according to the latest stats of the CDC. And Ashley, if you can throw up the chart right now, we can show. And unfortunately, in California, the numbers are at 1 in 22. By 2030, we will be at 1 in 2. And some of the latest predictions I had, it's going to take our country $17 trillion to deal with that kind of tragedy, where we have 1 in 2 children that are autistic. Right now, 1 in 6 children are diagnosed with attention deficit or anxiety. And I don't have the latest stats on depression, but I've heard that it's quite prevalent in the schools. And sometimes children as young as 8 years old are on 2 or 3 medications. And I think medications are very necessary at a certain point. Yeah, thank you, Ashley. Here's the CDC chart. And so I think that it's a time of crisis in our country, because the children are the most valuable asset we have to give to humanity, because they will either carry forward our ever advancing civilization, or it will decline. And I think it's past the time where we can just arbitrarily talk about these numbers and try to, alert people. Because what happens is that the field that I actually introduced, probiotics, in 1982 with my husband, Natren Trenev, has been completely derailed. And everybody and anybody is just quoting any literature and giving ineffective products in an era where we need very effective products, one for the large intestine, one for the small intestine, and one for the transient flora. Because believe it or not, the gut microbiome is responsible for producing up to 90% of the feel-good chemical serotonin, and about 50% or more of the dopamine, that those neurotransmitters are then transported to the brain via the vagus nerve, and makes it available for a better mood, a better perspective of life. So that's just one aspect. We could actually do a 2-hour lecture talking about the chemicals that are produced and not produced in the gut, that either make us happy or make us very sad. And the problem is that people are not aware that your thoughts can create those bad chemicals, and the microbes in your gut can also create the bad chemicals, because they're trying to take advantage of your body. It's very simple. The pathogenic microbes, or the not so friendly microbes, have been positioned in our gut, because there's over 1,000 chemicals in our food, our soil, our water, that's poisoning our body. And the poisons are turning on and off genes that we don't want turned on and off. And so it's creating a cascade of problems. And we're trying to put a Band-Aid on each problem without really going to the root of the problem, which starts in the gut, because you need to fix the gut. Because yes, I believe that neurofeedback is very important, because it's part of, your perception of reality. Your perception of reality, I feel, is changed by the neurofeedback. That's just as important. But the pathogens that have settled in the gut that are contributing to that problem have not been dealt with. So they can come back and slow down the process and not allow the healing to take place the way it should be. Because unfortunately, we do not have a clean diet. The children are not exposed to a clean diet unless the parents really dedicate their life to cleaning up the diet, to making sure what the child is eating. Eating out is hazardous, and making sure that the child is given every chance to recover, either from autism or from attention deficit. So it's a holistic process, and that's why I liked working with Vincenzo through our rep David, because I appreciate people who understand that the treatment modality requires a holistic approach. Because right now, here's the new things that most people don't know. Previously in medicine, it was understood that nothing could pass the blood-brain barrier. Wrong. Bacteria do pass the blood-brain barrier. Previously, it was thought there was no bacteria in the brain. Wrong. Bacteria can actually be found in the neuron and the neurons in the brain and can actually contribute to their decline or efficiency. What was previously thought that neurons cannot be replaced or that any type of mental issue cannot be reversed is wrong, because every year your entire brain is replaced, because every minute you lose 10 million cells, human cells, and those are reproduced. So if your body is not digesting and absorbing the right nutrients, you are not producing healthy proteins. If you're producing cheap proteins, to quote Dr. Dispenza, you're going to have a problem. You're going to have a disease because your body is not efficiently being replaced. And that's, where everybody needs to know this, because, you get diagnosed with dementia, you get diagnosed with Alzheimer's disease. Alzheimer's disease, it is not any longer an old age disease. It is now found in young people. And that's horrific. And I'm sure Anthony and Vincenzo have seen this in their practice. So the things that we've been told are not exactly true, and we need to really be informed if we're serious about tackling these problems. Another thing that I thought that most people did not know, that Alzheimer's and dementia is now unofficially classified as type 3 diabetes. It means the inability of insulin to be utilized by the brain cells to do their function. In other words, insulin resistance is part of type 3 diabetes. And this is something that everybody needs to be informed about, because without insulin being able to be properly utilized, you cannot generate energy, whether in the mind or in the body. And it's as simple as that. And I want everyone to think about treating the body holistically, changing their gut, not taking probiotic organisms to change just a symptom. Probiotics are not meant to treat symptoms, and many times the wrong bacteria can be used, which may help in one area but decrease the prevalence of other important beneficial bacteria in the 27 feet of the GI tract. So, now that I've given sort of a very fast, brief overview that usually takes 2 hours to explain, I'd like Vincenzo to give me some personal data that he had, using our 12-week course for his child, and what he's seen and what his vision is for dealing with the gut and neurofeedback in their clinics.
Right. So we have utilized a lot of ProTrend's products within our own home. My wife has used them pretty regularly as well. Both of our children were born via cesarean, and so we knew that there were some things missing with regards to appropriate bacteria early on, and we'd done a lot of research with regards to that. And we found that by replenishing a lot of those things with her 12-week program, that our kids became healthier and stronger much quicker. My first child actually spent a significant amount of time in the NICU prior to coming home, and we saw a lot of benefits in utilizing the program. So much so that I started utilizing it with a lot of my private patients, and we've been seeing a lot of growth, exponential growth in patients with regards to things such as language developmental delays and speech and language in particular. We've had benefits there, as well as sleep disturbances. We've had benefits with sleep disturbances. What I found most interesting was actually the pairing of those with the initial onset of neurofeedback therapy in alleviating some of the sleep disturbance symptoms that we found in patients pretty regularly. And so I found them to both be an excellent combination, and it's something that, as Anthony's aware, I speak of regularly in clinic with parents when I have parents of children who are exhibiting aggressive behaviors, sleep disturbances, and delays in speech. We often speak about their gut biome and correlate it with the symptomologies that we're seeing while doing our quantitative EEGs and then our neurofeedback therapy.
Mm-hmm. So I understand you two gentlemen have 2 clinics right now in the state of Connecticut.
Correct.
So you might want to say to those fortunate enough to have accessibility to your clinics, where they're found, and what is your process for neurofeedback, because I'm sure that many children will want to be treated by you, and I'm sure the parents would be very fortunate to have you available for their children to be helped.
Sure. So we have a clinic in Westport, Connecticut, and another one in Greenwich, which is about 30 miles away, but with 95, which is a very congested road, it can be an hour. So the clinics really serve kind of geographically connected but different areas. But we see a very wide range of patients and wide range of ages. I think the thing that really unites them is, number one, really a desire to find a different approach to treatment away from standard medicine, psychiatry, a growing unease with psychiatry, the fact that it doesn't really resolve any issues. You're masking them, you're temporarily changing them. Very much like the way you described the biome of the gut. You have to allow the brain to adjust and change itself, to heal itself. Just like the gut and your description of the whole body, the brain is constantly changing. It's the sort of miracle of the brain that neuroplasticity means that it's constantly changing and adapting. And all it needs is steering in the right direction to know what to do, and it will do it. But the beauty also, what we do with combining the nature of neuroplasticity with modern brain imaging is that we can really look at, measure, and understand what's going on in the brain to an incredibly detailed level. So when a parent comes to us with a child with autism or a diagnosis of ADHD, these diagnoses, they kind of go out the window. We look at it from the ground up. The DSM, the diagnostic manual, is really based on descriptions of difficulties. It's not based on what's really happening in the brain. But when you understand what's happening in the brain, you can create a program to address it directly, just like you can rebalance gut health. And the difference is staggering. Most of the children that we see and adults that come to us on medication completely come off, most of them, successfully, and do better without medication than they did on medication, without side effects. It's a very, very powerful modality. And honestly, I feel very, very fortunate to have found my way into it and grown in the field. It's a great place to be.
Yeah, thank you. I just wanted to add that, replenishing the body is necessary. And I think you need to address the entire body when you're trying to heal the brain, because your gut is producing the proteins and your brilliant body decides where those new cells need to be placed. And therefore, you don't want to have organisms that are impeding that process or possibly hampering that process. And I think a dual effect. And I just want to assure everybody that's gotten older. I'm 76 years old. I don't mind telling people that my brain still functions. A friend of mine did an EEG on me and said, "You've got such a fast brain, it's unbelievable." And I said, the brain is only a function of what the rest of your body is doing. Your brain, functions if the rest of your body is functioning. If you have problems in the rest of your body, certainly it would also affect the brain. And I want to give everybody hope who's been diagnosed with dementia, Alzheimer's, whatever, there is a change, there is a feasibility for change. Nothing is irreversible because the body is brilliant. We just have to figure out what tools we need to give it so that it can heal itself. And I think we've been led down this path that if we get one of these problems, we'll never be able to get rid of them. And as the body and the brain is changing, as you well so put it, we have an opportunity to change everything if we so desire.
I think, that you said something that I think is very important to us as well. I think that in medicine there's been this tendency to look at everything in isolation, look at the gut, look at the brain, and that's not how the body works. You have to take an integrative approach to what's going on. We found it with hormone levels in the brain. I've had people recently who've been diagnosed with issues with various hormones and found very powerful links between them and different brain structures. And so, you can't ignore the interrelationship between all these different fields. Having an integrative approach is vital.
Yeah, I think so. And I think those of us, we are the pioneers because I think problems in the body are not only psychological, they're also physiological. As I stated last week, I've recommended this book. I don't know if you've read it, The Indoctrinated Brain by Dr. Michael Niels, in where he says the spike protein does not only damage to the body, but actually damage to the brain and reduces the size of the hippocampus and causes a lot of problems. And, I'm about following the science. And I do respect Dr. Niels. He's a medical doctor and a molecular geneticist. He's got an impeccable career. And I take seriously what he said. So I think our approach by dealing with it physiologically and psychologically is the right way. We just have to find the right combinations for each individual patient, which I think you probably are committed to as I am, because each one of us is an individual. Just for instance, each one of us has an individual composition of microbiota that's unique to us, like our fingerprint. So one function does not fit everybody. And I'm sure you've seen that in your practice as well. And that's why I'm happy to work with you, because I think you realize that each patient has individual need. Yes, we have a structure where we start from, and as long as we're not harming anybody, it's perfectly okay. But we are committed to adjusting to each individual, because I think we're both committed to helping the individual, especially a child that has needs and needs to be helped from not just only from a mental and business point of view, but also from the heart, because this individual is suffering, their parents are suffering, and we need to do everything we can to help this child that's given to us in our capacity to do so. So having said that, the microbiome has been significantly disturbed, especially in the North American region, probably in the European region, whereas before, 75 years ago, 80 years ago, we had high quality fermented foods. And how do I know? Because my family introduced natural style Bulgarian yogurt to the United States in the 1960s. We were the first ones to introduce the liquid acidophilus, which nobody knew what we were talking about in that era. So we figured out then that there was already a problem and a decline in the composition of the microbiota in the microbiome, because remember, the microbiome really stands for the sum of all the genetic material of the 100 trillion microbes that line our 27 feet of GI tract. So those genes number 248,000 genes versus our 22,000. So it's we're outnumbered. And so we have to create that symbiosis with that microbiota that are in their gut, so that the microbiome can also be an assistance and not a hindrance. I hope that makes sense. So Anthony, if you want to, maybe say something from your perspective and your clinical viewpoint.
Yeah, I mean, I feel like the closer we can get to individualized medicine and away from broad labels that don't really describe how individuals work, the better. The further we can get away from, the generic diagnostic labels for kids, which invariably inaccurate and inadequate, and really embrace the need to be holistic with the way we feed our children, the way we treat them. Every aspect of their lives is important to their well-being, with diet being a foundation of that. And thank you for your work in that field.
Thank you. And before we jump, I wanted to give Vincenzo an opportunity to give his thoughts and what he's seen on a clinical level. And, I'm encouraged.
So, there's a ton to be said for, as Anthony called it, basically a personalized medical approach. And as you're saying, Natasha, genetically, everyone is so very different. We see it often at Gray Matters. Obviously, as Anthony knows, when we speak to clients and we're talking about generalized brain mapped profiles are one thing. However, every protocol we write is so individualized because everyone's brain, as I describe it to patients regularly, is like a fingerprint, as is our entire genetic makeup. And so I've seen some very interesting things with regards to that gut-brain connection, in regards to changes, as you described earlier, Natasha, in serotonin levels, and how that directly impacts brainwave activity. So it's been very interesting to be able to integrate all of those things collectively. And again, it is person to person, very, very dependent. We can't get hung up in a broad generalization of how we should treat somebody by their externalizing presenting symptoms. Because if that were the case, then all these diagnoses that are based off of the DSM-5 would be just that. And there would be only one modality of treatment that would work for them, that was already written out in black and white, and we would have to go with that. And we're proving day by day that doesn't seem to be the case.
Yeah, right. And so I think that we're aligned, and I encourage everybody to reach out, because in about a couple of minutes we're going to switch to our IG Live format. You can reach out to Natren, to ProTren, to the clinic, either reach out to Vincenzo or Anthony. I think we're aligned, and I think it's a few good people what it takes to start making change. Because once the parent sees the change, I'm sure they'll be happy to share that with other people, especially if we have done absolutely no harm and only good. And my heart goes out because I've seen the parents deal with these children, and it's very difficult, extremely difficult. And I always call them my heroes, because until you've seen that interaction between the parent and the child, you have no idea the patience, the dedication, and the love that has to be shown each and every day to this child. And some even have children in order to deal with it and try to get better. And I'm encouraged that I have people who were aligned with me, such as you, because I believe, again, strongly that it's not just a psychological issue, it's a physiological issue as well. And both of them have to work in harmony in order to get the desired result. And unfortunately, from my 56 years of experience, diet alone will not do it. I tell people, stop feeding your children any sugar, processed carbohydrates. I know it's difficult. I've had a child, and it was not easy. And change their diet, get the supplementation in right, get them into the right therapy, make their lives happy, because a lot of these children I've seen are very unhappy. And it's, my pleasure to see any kind of improvement that helps not only the child, but the parent as well, because that's what the relationship should be about. It should be a happy, joyous relationship, and not one just based on hardship and trial each and every day. So having said that, I think we're ready to go into our IG Live. Again, please either contact Vincenzo or Anthony, or contact our professional division Protren, our regular division Natren. If you have any questions, we really all have people who want to help you. And it's not just about marketing or making business. We are dedicated first to helping you, and especially your child, get the results that you deserve and need. And hopefully we can see more of your clinics spread nationwide.
Thank you, Natasha.
Yeah. Okay, so I think we're finished with this format, and we're going to be ready to jump now to the format to IG Live. So everybody hold on to your seats, because this is a new format. I used to do radio and television, but this is a little bit new for me. So hold on, everybody, while Ashley switches us on to IG Live. So Ash, if you're there, please let us know when we're switching. So I think we have to end this stream and start the new one.